Schizophrenia. Schizophrenia is a mental disorder that affects the way a person perceives reality, thinks, behaves, and controls emotion. Both men and women are affected by this disorder, but men generally are diagnosed earlier. Most men are diagnosed in their late teens or early 20s, and women are diagnosed in their late 20s and early 30s. Most are diagnosed after the age of 12 and before the age of 40. There are some different types of schizophrenia. These include paranoid, which involves delusions and hallucinations, catatonic, which has to do with unusual motor activity, extreme negativism, peculiar posturing. Third is disorganized, which occurs at an early age and involves disorganized speech, flat affect, some hallucinations and delusions. The fourth is undifferentiated, which those symptoms don't fit in with any of the other different types. And the fifth is residual, at least one episode of schizophrenia experienced in the past, but no longer exhibiting causes or signs and symptoms of the disorder. Some risk factors. People at risk for developing schizophrenia are those who have a family history, the father was of an older age when conceived, the mother had pregnancy or birth complications, exposure to toxins, and taking drugs or using substances in the teen years or early adulthood that can alter the brain. There is no known cause for schizophrenia, but it is believed to involve genetics, the environment, and the brain chemistry. And if you look here in the pictures, this is a normal brain with normal levels of dopamine, and then here's a brain of a schizophrenic patient that has the elevated levels. And then down here's some more pictures of a healthy brain versus a schizophrenic brain. There are many symptoms that may occur with a patient with schizophrenia that involve behavior, thinking, and their emotions. Some of these symptoms include delusions, hallucinations, disorganized thinking or speech, disorganized or abnormal motor behaviors, and negative symptoms. Negative symptoms include lack of pleasure, flat affect, withdrawal from others, struggling to take care of self, and trouble staying motivated. And to diagnose schizophrenia, we'll do like a physical exam, a psychiatric evaluation, criteria of the DSM-5, which I'll go over in just a minute here. And lastly, we rule out other causes that may be causing like the hallucinations. So we rule out for like drugs and alcohol or other medications that may be causing some symptoms similar to schizophrenia. So here's the DSM-5 criteria for schizophrenia. A is 2 or more of the following, each present for a significant portion of time during a 1-month period or less if successfully treated. At least one of these must be 1, 2, or 3. Delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. B, for a significant portion of the time since the onset of the disturbance, level of functioning in one or more major areas, such as work, interpersonal relations, or self-care, is markedly below the level achieved before the onset, or when the onset is in childhood or adolescence, there is failure to achieve expected level of interpersonal, academic, or occupational functioning. C, continuous signs of the disturbance persist for at least 6 months. This 6-month period must include at least 1 month of symptoms, or less if it's successfully treated, that meet criterion A, active phase symptoms, and may include periods of prodromal or residual symptoms. During these prodromal or residual periods, the signs of the disturbance may be manifested by only negative symptoms or by 2 or more symptoms listed in criterion A present in an attenuated form, like odd beliefs, unusual perceptual experiences. D, schizoaffective disorder and depressive or bipolar disorder with psychotic features have been ruled out because either 1, no major depressive or manic episodes have occurred concurrently with the active phase symptoms, or 2, if mood episodes have occurred during active phase symptoms, They have been present for a minority of the total duration of the active and residual periods of the illness. E. The disturbance is not attributable to the physiological effects of a substance, drug abuse, or a medication, or another medical condition. F. If there is a history of autism spectrum disorder or a communication disorder or childhood onset, the additional diagnosis of schizophrenia is made only if prominent delusions or hallucinations, in addition to the other required symptoms of schizophrenia, are also present for at least 1 month or less if successfully treated. Specify if the following course specifiers are only to be used after 1 year duration of the disorder and if they are not in contradiction to the diagnostic course criteria. First episode currently is acute episode. First manifestation of the disorder meeting the defining diagnosis symptom and time criteria. An acute episode is a time period in which symptom criteria are fulfilled. First episode, currently in partial remission. Partial remission is a period of time during which an improvement after a previous episode is maintained and in which the defining criteria or the disorder area are only partially fulfilled. First episode, currently in full remission. Full remission is a period of time after a previous episode during which no disorder-specific symptoms are present. Multiple episodes, currently an acute episode. Multiple episodes may be determined after a minimum of 2 episodes, after a first episode of remission and a minimum of 1 relapse. Multiple episodes currently in partial remission, multiple episodes currently in full remission. Continuous. Symptoms fulfilling the diagnostic symptom criteria of the disorder are remaining for the majority of the illness course, with subthreshold symptom periods being very brief relative to the overall cause. Unspecified. Specify if with catatonia. Specific current severity. Severity is rated by a quantitative assessment of the primary symptoms of psychosis, including delusions, hallucinations, disorganized speech, abnormal psychomotor behavior, and negative symptoms. Each of these symptoms may be rated for its current severity. Most severe in the last 7 days on a 5-point scale ranging from 0, not present, to 4, present and severe. Treatment uses a combination of psychopharmacology and psychotherapy to help manage symptoms and allow the patient to function at their optimal level. Second-generation antipsychotics are usually chosen first due to less severe side effects. Abilify, Zyprexa, Seroquel, Risperidol are just a few examples of those. First-generation antipsychotics include Haldol and Thorazine. Along with pharmacological measures, individual, group, and family therapy is used. Cognitive behavioral therapy is where a patient is taught to change their thinking and behavior. Lastly, in severe cases or when nothing else is working, electroconvulsive therapy may be used. ECT involves placing an electrode to the patient's scalp while the patient is under general anesthesia. A small electric shock is sent to the brain. This treatment leads to improved thinking and mood.